Hello.
Hello, I'm
Hi.
Runa. Nice to meet you, Kylie.
I'm Kylie.
I'm going to be your nurse today.
Okay.
Today, I'm going to be doing an assessment, a musculoskeletal assessment, as well as a neurological assessment.
Okay.
I'll be assessing muscles and joints, and then neurologically, a lot of your cranial nerves and things like that. So is it okay to get started?
Yes, ma'am.
Okay, I'm going to ask you a couple questions first.
Okay.
Kylie. Can you tell me your name, full name and date of birth?
Kylie Giles, 3/11/99.
Okay. Okay, Kylie. Can you tell me if you have allergies?
No, ma'am.
Okay. Do you have any, have you ever had any problems with muscle pain or joint pain?
No, ma'am.
No? Okay. Do you have any problems with headaches?
No, ma'am.
No? How about any blurred vision?
No, no.
Okay. Numbness or tingling?
No.
Okay. Dizziness, fainting?
No.
Any memory loss?
No, ma'am.
Any difficulty swallowing?
No.
Changes in behavior? Muscle function?
No.
Okay. Do you have any family history, your grandparents or your great-grandparents? I'm sorry, your parents or your grandparents. Is there any family history with muscle or joint disease or any of these neurological issues that we've talked about?
No, ma'am.
Okay. All right. Well, that is good to hear. We're going to go ahead and get started if you'll bear with me. I'll be inspecting, I'll be palpating, which is feeling, and we'll do a couple little fun things, and we'll try to get through this as soon as we can, okay?
Okay.
All right. First, I'm going to be inspecting your neck. What I'm looking for is symmetry, and that means same on each side, okay? I'm looking at your shoulders. You set your back up really straight, and I'm just looking for symmetry here to rule out any scoliosis, one shoulder up higher than the other. As I do these things and I inspect, I'm also going to ask you to test strength in some of these certain areas, okay? So push your head towards me, okay? Now pull it back against me, okay? Now try to turn your head facing me, okay? And now the other way, okay? Can you touch your neck to your chin to your neck, okay? Side to side, okay? And then look up. Okay, very good. Now I'm going to put my hands here. If you'll shrug your shoulders, okay? Now if you will put your arms straight out, I'm gonna push down and you press against me. Okay. Now the other way. Okay. Now hold your arms out, and we're gonna do the same thing. There and there.
Okay.
Okay. And then put them up above your. Okay. Very good. Okay. Next, I'm gonna be looking at your arms and your elbows, and again, we're just going to be looking for symmetry. Make sure. Look at your skin and make sure that there's no discolorations or swelling or skin folds, anything that would be abnormal. I'm also going to be testing, or not testing, but feeling your elbows here. Can you bend for me? Okay. And out. All right. Same with this one. Bend for me. Out. Can you bend your arms for me like this? Sorry about that.
Oh, you're fine.
Okay, same again. There it goes. Okay, and then straighten them out for me. Okay, all right. Next, I'm going to be looking at your wrists. Just feeling that everything feels good, and if there's any tenderness anywhere that I touch, you just let me know. Okay. All right. Can you take your wrists and put your hands down and then up for me? Okay. And then I'm going to also test the strength of your wrists. So if you will pull up for me as I push back and then down. Okay. All right. And then I'm going to be looking at your hands. Do you ever have any pain in your fingers, any of your joints?
No, ma'am.
No? Okay.
I've had my hand go to sleep before, stuff like that, but
Yeah,
that's
that's
about it.
pretty normal. Your hands and feet fall asleep.
Yeah.
Okay. All right, go up your fist for me. Okay, and release. Okay. Squeeze my fingers for me. Okay. Very good. Okay. Next, I'm going to be just inspecting your hips and your thighs, your knees, your legs, your ankles, and your feet.
Okay.
Okay. The best way, the best way to test, if you could stand up for me, I'm looking for symmetry here. Okay. Legs, ankles, okay. Feet. I'm just going to be feeling your knees here.
Okay.
Okay, you can go ahead and have a seat. I'm going to sit behind you and just brace your back here. Now, if you'll lift up this leg for me,
Okay.
up, I'm going to push. Okay. Same here. Push.
Okay.
Okay. Now, you try to let's see. Now you try to push down on my hand. Okay.
Okay.
Same with this. Push down.
Okay.
Okay. Now we're going to test the strength of your hips. So I'm going to hold your back, and if you'll lift your leg up here, this one. Okay. Very good. And this one, same. Okay. Very good. Do you have any any tenderness or any pain in your joints, your knees when you run or walk?
No, ma'am.
Okay. All right. And let's see. Okay, if you will put your legs out for me, straight. Put them up in the air. Okay. Now I'm going to push down on them, and you try to. Okay. And then I'm gonna. Okay. Very good.
Okay.
All right. Now, if I'm gonna take a look at your ankles, I'm just gonna look at them here. Any tenderness?
No.
No? Okay. Roll your ankle for me. Like,
Okay.
okay, very good. And let me feel this other one. Okay, now roll that ankle for me. All right. Now, stick your toes up in the air, and I'm going to pull back, and now you point your toes down, and I'm going to pull back.
Okay.
Okay, very good. All right. Can you take your socks off and let me look at the soles of your feet? Okay. Just looking at your arch and your toes here.
Okay.
Okay, bend your toes. Point them up and then point them down. Okay. See this. I'm just going to inspect each of your toes, each of the bones. I'm going to look at the soles of your foot, look at the arch. Okay. Now point your toes up, and now point your toes down. Okay. Very good. All right. Now if you'll stand up for me, we're going to do your spine. Okay. Now I'm going to stand here, and I'm going to stand behind you. I'm just looking at symmetry here.
Okay.
Bend over and touch your toes for me. Okay, I'm looking at the curvature of your spine. Okay. All right. And you can stand up. Okay. Now, can you go side to side? Very good. Very good. Okay. And now, kind of roll. Okay, very good. Okay, you can have a seat. Very good. All right. Trying to make sure that I covered everything, hands and wrists. We assessed for strength, and we inspected your muscles for symmetry. And we looked at your skin. at your joints in your hands and your feet. We tested your range of motion in your spine, so I think that we covered this.
Okay.
Okay, so next we're going to move on to the neurological exam, okay?
Okay.
You said you hadn't had any headaches or blurred vision, anything that was out of the ordinary. Now we're going to test your cranial nerves.
Okay.
And we'll do this in a few different ways. We have cranial nerves 1 through 12, okay? And each time that we test one, we're testing for something different. So can you close your eyes for me? Okay, and smell this on my hand. Tell me what you smell.
Oranges.
Oranges. Very good. Okay. Can you tell me what this smell is?
Peppermint.
Very good. Oranges and peppermint, essential oils. So you got that right. Your nose works. Could you read this for me, please?
Fridays, choose 2 meats and get 2 sides, $14.99. 15 combinations, ribs, steak, seafood, and more. Order online at Fridays.com or download the Fridays app.
Okay, very good. Now, if you could cover one eye for me, okay, and you look straight at me and you tell me how many fingers am I holding up over here by looking at me?
3.
3, okay, very good. Can you tell me here?
2.
2, okay. Now, cover your other eye.
Okay.
Are you focused?
Yes.
Okay, can you tell me how many fingers I'm holding up by looking at me? Keep your eyes directly on me.
3.
Okay, and
2. 1.
1, yes. Okay, okay.
Now
Now,
keep it covered.
no, you can open and cover it now. We are going to, looking at me and not turning your head, just moving your eyes, okay? I want you to follow my finger, okay? We're going to go up, we're going to go out, we're going to go down, okay? We're going to go up, we're going to go out, and we're going to go down. Okay, very good. Next, I'm going to look in your eyes and just make sure that your pupils react to light. Okay, what I'm seeing here is your pupils constricting, and I'm also seeing the other pupil constrict at the same time. Okay. All right. And one more time. All right. Okay. Now, if you will close your eyes, I'm going to touch your face in a couple different places, and you tell me when I touch your face. You touch where I touch, okay? Okay, very good. Okay, now look at me and smile. Okay, close your eyes really tight. I'm going to try to pull your eyelids open and you keep me from it. Okay, very good. Now puff out your cheeks for me. Keep me from pushing air out. Okay, okay, very good. Now, if you will open up and stick out your tongue and say ah, I'm going to be looking at your uvula and make sure that it's in the center. Okay, very good. Now, once again, I'm just going to have you to shrug your shoulders. Okay? Okay, press it to my, okay, very good. Come back. this way. Okay, and look this way. Okay, very good. Okay. Now, if you could take your hands here, put them in your lap, and turn them over, and back over, turn them over, and back over, and do it very fast. Okay, very good. Okay. Now, if you could take the heel of this foot and run it down the shin bone of that leg. Okay, and do it again. Heel of that foot, the shin bone of that leg. Okay, very good. All right, now, stand up for me. Okay, now close your eyes. Stick both arms straight out in front of you. Okay, and right here I'm just checking balance. Okay, all right. Now I would like for you can open your eyes now. I would like to watch you walk across the room there. Walk straight across the room. Okay, and turn around and walk straight back towards me. Okay, now we're going to do a heel to toe. Okay, so turn back around. Put your heel, this heel in front of that toe, all the way across. There you go. Very good. Heel to toe and heel to toe. Then when you get to the edge of the room, you can turn around and walk back towards me. Very good. Okay, you can have a seat again.
Okay.
All right, so now I'm going to have a tuning fork here. What this is I'm going to test your ears. Okay. What we're looking for with this is I will hit it up against my knee. I'm going to place it right here in the top of your head, and what you'll be feeling for is vibration. Okay. And I want you to tell me, do you hear it equally in both ears?
Okay.
Okay, so we're going to do this first. I'm going to hit it on my knee. I'm going to place it here. And you tell me.
Yes. I can hear it in both ears.
You hear it equally in both ears?
Yes.
Okay. All right, the next thing we're going to do is called this was the Weber's test. And the next one we're going to do is the Rhine test. I might be getting those backwards. But I will, I'll hit this, and then I'm going to place it here on the bone, on the back of your ear, okay? And then you tell me if you hear that, okay? And then I'm going to place it here in front of your ear, and you tell me how long it takes you tell me when you stop hearing it, okay? All right, so here we go. I'm going to hit it. Tell me, do you hear that?
Yes.
I want to place it here in front of your ear. Hear it?
It just stopped.
Okay. It's 4 seconds. Okay. So we're going to do it on the other side. Okay. Hit these here. Put it on your bone back here. Hear that?
Yes, ma'am.
Okay. Now I'm going to put it here in front.
It just stopped.
Okay. That's also 4 seconds.
Okay.
Okay. All right, next, if you'll push your sleeves up, we're going to be testing touch, okay? I have 3 different touches. I have a sharp, a dull, and a soft,
Okay.
okay? And I'll have all 3, and I will be touching both of your arms, and you tell me what you feel, okay? So
you said sharp, dull, and soft.
Sharp, dull, and soft.
Okay.
Okay. All right. So close your eyes and you tell me what you feel.
Soft. Soft. Dull.
Yes. Very good.
Sharp. 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 Soft.
Dull.
Dull.
This is soft.
Okay.
This is
Dull.
Dull. Okay. And then one more.
Sharp.
Okay, very good. All right, you can open your eyes now. All right, now I'm going to take your hands here, and with your eyes closed, I'm going to move your finger in a direction, either up or down, and you tell me which direction I'm putting your finger, okay?
Okay.
All right, so I'm going to take this finger here.
Up. Down. Up. Down.
I'm going to do the same thing with your toes.
With my eyes closed.
Yes, eyes closed.
Up. Down. Down. Up.
Okay, very good. All right. Next, if you just want to keep your eyes closed, stick out your hand, and I'm going to put an item in your hand, and I want you to tell me what this item is, okay? With your eyes closed. You feel that object, and you tell me what you think that is.
A paper clip.
It is a paper clip. Very good. All right. Next, I have what I did have for my next strip. Okay. Open this hand for me. What's this?
A pencil. A mechanical pencil.
Very good. Okay. One more time with this hand.
Paper clip.
Close.
Not a paper clip. Are they called a clothespin?
Yes, a safety
A
pin.
safety pin. Yeah,
Yes.
that's what I'm.
Okay, very good. All right. Now, I'm going to, with your eyes closed, I'm going to write a letter in your
Okay.
hand, and you tell me what this letter is.
Okay.
Okay?
A B.
B. Okay. How about this? It's a letter, or a number, I'm sorry.
3.
Okay?
4.
Mm-hmm.
Can you redo that? 2.
This is a letter.
Z.
Very good. Very good.
Do I leave my eyes closed?
You can open them. Okay. So, also too, I wanted to touch your feet, and you tell
Okay.
me if it's soft or dull, okay? So put your feet side by side.
One more time. You said, are we not doing the sharp one?
Soft, dull, or sharp.
Okay. Dull.
One more time.
Soft.
Soft, okay. How about
Sharp.
very good.
Dull.
Mm-hmm.
Dull. Soft.
Okay, very good. Okay. Now let's see. Well, Ms. Stiles, I think that this concludes our assessment today, and I
Okay.
appreciate your time, and you did a great job, and it was good to see you again.
You too.
All right, thank you.
Thank you.